Lauderdale, Florida. I can't imagine what that's like right now. But anyway, this is a very interesting topic because there are so many men that they don't want to, like Joey Logano in NASCAR that we've talked about. We had one of the MRN people on talking about that. He has alopecia, and he was wearing a piece, and he said it was itching and it was very uncomfortable, and he decided to just say the heck with it. So I think Dr. Brett Bolton would definitely be able to assist him, and I'm going to send it to Joey.
Well, there you go.
And see what he says. But let's bring him on. Let's have this conversation. Good morning, Dr. Bolton.
Hi there. Thank you so much for having me.
Yeah, our pleasure. So, yeah, it's interesting because we have one of the top NASCAR drivers with a problem, and I'm sure he would like to have his hair back. But do you treat people that have alopecia?
Absolutely. So there's different types of alopecia. The worst type of alopecia you could have is called alopecia totalis. That's where you have complete loss of hair, and unfortunately, at that point, there's nothing to do until they figure out the science how to reverse that. But regular alopecia is when you can get it's basically you get little spots, and generally they come and they go. So a lot of times when I have a patient that just has plain alopecia and they just get an area that opens up, I tell them just, don't worry about it. Many times it goes away within 6 months, and you'll start seeing it come back. What's happening is the hair is going into a resting phase. It's a genetic factor that some patients are affected by, and it moves around. And so they might have it in one spot, and then it moves to another spot, and they panic and they want to go get surgery, but I tell them, save your money. Just wait it out. It goes away.
If they did get surgery, would that new hair that's in there be affected by an upcoming incident with alopecia or no?
Great question. And the answer is no. It shouldn't, because that hair, let me rephrase that carefully. So the hair that we're moving from the back of the head is genetically pre-programmed to be not to be sensitive to the same conversion that causes the genetic hair loss in general. But that might still be susceptible to the alopecia gene. So maybe, but chances are no. Usually when you move those pieces around, it's a different DNA, and not all DNA is affected the same.
Now, do people people who need this, do they have to have hair somewhere on their head to do this?
Absolutely. You absolutely have to have something for me to work with. We're currently not at the point where we're able to replicate cells. That's on the frontier right now, where they're doing a lot of tests for cell therapy, where they're replicating cells without any hair. But currently, if you don't have any hair for us to move, unfortunately, we can't do a hair transplant on you. I mean, not unless you got a lot of beard hair, or let's say you got some nice leg hair you want to use. People do body transplants, but they look weird. Your beard hair looks like a beard hair. Your arm hair looks like an arm hair. Yeah. Your butt hair looks like a butt hair.
Okay, not that.
Yeah, that'd be that would be very interesting indeed. So, a question is, what exactly are you doing? You're taking hair, actually individual hair follicles from one place and moving it and putting it in another place. How does that work?
Okay, so I've been doing this now for 30 years. Going on 30 years. I just had the great fortune of being chosen by the world's greatest television show as the world's greatest hair transplant surgeon. And that's why I'm getting to do all this fun media. And so what's happening with hair transplant is it's evolved considerably in the 30 years I've been doing this. The standard practice for a hair transplant today is it's called a follicular unit transplant, which is where we're moving one hair graft at a time. So it's super soft and natural. And then we're using a hair that's called a follicular unit. A follicular unit, these are naturally occurring bundles of hairs we all have in groupings in the back of our head. And we're taking these little groupings and individualizing them, and then putting them behind the little soft one hairs, and then creating a nice, soft, natural looking hairline and hair transplant. The big thing that changed, there's a caveat to this whole industry that's happening right now is there's a technique called the follicular unit extraction, okay, where patients are flying out to Turkey to get this done, right? And it's a technique how they harvest the donor hair. So instead of taking a strip where we open the patient's back up where the donor is, and we take that good hair that's not affected by the hereditary hair loss, they're taking little punch biopsies and poking little holes to get the little follicular units out. And when they're doing so, they're taking it outside of what's called the safe zone, the safe area to get, hair that may fall out later. They're taking in larger swaths, which are creating more patients trouble in the long run as far as fibrosis with scar tissue. They're over-harvesting the donor with this technique. So the worst part of it is all technicians are doing it. So people are flying to Turkey. They're thinking they're getting a quality hair transplant. Their whole case is being done by technicians in Turkey.
Wow.
Even in the United States, it's the Wild West. The follicular unit extraction method is being done by non-physicians all over the country. So it's a big concern.
So,
I'm doing everything I can to try to bring awareness to it.
Yeah. So what red flags?
I'm sorry?
What red flags should people be looking for when they're...
So what you need to do is you need to, first of all, meet the doctor, make sure that's all he does. You want to know what technique he's using to harvest the donor. If he is harvesting the donor using a follicular unit extraction, you want to ask, who's doing that? Who's the qualified individual that's puncturing my skin, and is he licensed to do so in your state? And it's very important. We're seeing so many botched jobs from these FUEs where the donor's depleted and they got this tear. I mean, we learned about all the complications from this technique from the plugs.
Wow.
Remember the plugs, those
Sure.
big, huge, doll hair type looks from the 60s and 70s. Remember that at all?
Oh, absolutely. They never looked right.
Oh, it's horrible. Well, that's the harvesting technique they used for those plugs. It was called the punch biopsy. So they just put a fancy name to the oldest, worst procedure in transplant, gave it a fancy name to resell it to the public, so the doctor can go do his boob jobs or go do his dermatology practice, hire some technicians, throw him in the back room, and quadruple his revenue. And that's what's happening. It's very unfortunate.
And we're speaking with Dr. Brett Bolton from the state of Florida. Couple of questions here for you. If the hair has an area where obviously it's receded, why is the hair from another part of your head? How does it know that it's not an area that, or what causes that area to lose hair to begin with? And how does a piece of hair from an area that's growing make it in an area that couldn't grow before?
Excellent question. Okay, so with men, it's straightforward when they're losing their hair. It's genetic male pattern hair loss. And what's happening is genetically, we have a hormone conversion that's taking place where the testosterone in our body is converting into something that's called dihydrotestosterone, better known as DHT. When that DHT builds up, it causes a mucousy secretion called sebum to build up. And this sebum buildup will then miniaturize the hair follicles, and then that keeps the hair from making its way through.
Interesting.
For whatever reason, that hair in the back of the head, when you see those guys with that little ring around the back, that hair is genetically not affected by that male pattern loss. So when we do the transplant, we're staying within the center of that zone to give it room to come up, come down, and that's called the safe zone. And then we're taking that good hair that's genetically not affected by the genetic hair loss, we move it wherever we want to move it. It has a blood supply, and then it grows it fine. It's just like growing like a normal hair. It's like moving a good tree. Take the tree from the back of the house, put it in the front house. It grows. Same thing.
What's your trademark, this MaxHarvest procedure? What is that? Why is that different?
Okay. You know what? I love your questions, guys. Thank you so much. Okay, so because I started off I've been a pioneer with these one hair grafts. I was at the conference when they first came out. There's been such a everyone threw out the bigger grafts. Everyone went all the way from these. We went from these plugs, these big, huge grafts. Believe it or not, they had terrible technology, but they got a lot of hair. Then they went all the way to these one hair grafts. And what they're missing is they can't get density. It takes 5-7 surgeries to get density when you're only using these one hair grafts, these 2-3 hair grafts. That's it. So what I needed to come up with, because I saw these great results with these plugs, I said there's got to be a middle ground. So they were doing punches for those big grafts. So I started messing around with different slit sizes and different graft sizes. And so what I do that's unique to the industry is not only do I do the one hair graft in the front, followed by those little 2s and 3s, but once you get behind that, I start using what I call them the Bolton bundles, but they're just basically density grafts. They have 2 to 3 of those follicular units in a single slit graft. So it's not a punch. You don't see the little cuts. You don't see them. It just creates more density. And I get my patients out of my office with less surgeries. And the reason I got that wonderful honor as chosen as the world's greatest is they said, you're the only doctor that didn't cave to this FUE craze. I said I wouldn't touch it with a 10-foot pole. I could quadruple my revenue, but I wouldn't do that. It's not the right thing. It's not how you do the proper way to get the donor. And that was the main thing. They're like, you've been doing this 30 years. Your results are incredible. But the main reason is you're the only one who stuck to your guns and didn't follow the herd. And in addition to that, I try my best each and every time to get the patient as much hair as I possibly can. So I'm trying to limit how many times the patients have to come back for surgery. We'll stabilize them on preventive treatments. There's 2 FDA-approved treatments, both FDA-approved, finasteride and minoxidil. We immediately get you on that. And then we try to move as much hair as we can and limit how many times you have to come through my office.
Now, I got a couple of questions here for you today. How about now, if you're taking hair from someplace else on your head, back of your head, what happens to that area? Does that get exceedingly thin, or is that noticeable?
Another great question. You know, if you were shopping for a transplant, you're asking the right questions. So if you were to go in for a follicular unit extraction and you were sold on this, the answer is yes, because think of Swiss cheese, okay, and American cheese. I poke holes all over the back of your donor area. Then I do it again. How's that going to look? I have a million pictures on my website showing it. It looks like it looks super wispy. I hate to use the term cat. A lot of times you see those patients that are sick. Their hair thins out in the back. It's patchy. It looks terrible. They shave their head. They have holes all over. I mean, it's just you can see how I feel about this procedure. When I do a strip, I take an incision, trying to go usually as long as I can go, from one side to the other side as long as I can go, and then as comfortably as I can get out as far as elasticity is concerned. We approximate the edges, we bring that together, and then the hair falls right on top over it. So you don't see it. So you get a little hidden line under there.
Okay.
The reason everyone was so afraid of these lines is because when I started 30 years ago, all the doctors were doing these disposable stitches where they just dissolvable stitches, and they were opening up and they'd get these monster huge scars. So I immediately saw what they were doing is wrong and immediately did a regular closure, and then start, perfecting my closure to leave these undetectable scars. And that's what scared everybody. So everyone was thinking, oh, I don't want that, because there's all those bad pictures out there. But a quality doctor is going to get you a good suture line. I mean, it's not that complicated. So any quality doctor can get you a good suture line.
Is this a painful procedure? And
how long does it take?
I mean, obviously, if you're in there for the 1 day, what you're doing, how painful is this? And what do you take for it?
Okay. So I'm going to compare both procedures for you since this is the new fad, this FUE. I had a week recently where the patients came from Turkey. My whole week was a corrective surgery of Turkey patients. A few of the patients told me they were on a table for 2 days poking out the little holes.
Oh,
2 days. Gosh. just to get the donor out. And
I don't even want to do something I like for that long.
Oh my God. No, you don't want to be there 2 days. You need more anesthesia. It causes more pain. My patients get to my office. Like I have a patient today. He'll get there at 9. He'll be in the chair between 9:30 and 10. I'll have the strips out by 10:30. So he'll sewn up. I'll make all the anesthesia. I make the openings around 11 o'clock. The team starts to place. It takes them about an hour to 2 hours to put the grafts in. So most of my patients are out of my office by 1:30 and 2. And I move more hair than anybody in the world. I'm taking out cases that literally I go from one side to the other side as long as I can go and as much as I can comfortably get them on a daily basis. And we don't have any issues with scars. We don't have any issues with, if anything's if anything's not right, I tell the patient, come back to me. I fix it guaranteed.
But is there pain?
Doing that for 30 years.
Are they in pain for like a day or two, or is it like a headache or what?
The procedure itself is local anesthesia. It's like when you go to the dentist, you get a couple little pinches. That's the most uncomfortable part of the pinches. That's the part nobody likes. They're getting shots. Once you get those shots in, you're numb. You don't feel anything. You're just sitting still, watching TV, relaxing. And the patients that listen are going to have a different aftercare than the ones that don't. So I tell my patients, listen, you just had surgery. They think they have the day off the next day, so they're going to clean the garage and stuff, right? And do some chores around the house. Don't do that. Sit still. Keep your blood pressure down. Don't move around. Moving is your enemy after surgery. You're going to get more swelling, more pain. You're going to accidentally hit your head. You're going to do something silly. So we want you just to chill out for 72 hours at least, where you're couch, bed, toilet, kitchen table, basically just real minimal motion. And then once you get past that first 72 hours, everything's really settled in there. Then you can start moving around. I don't want you to go to the gym or anything, but 10 days to 12 days stitches are out. All the little scabs and crusts, small ones, usually gone in 7 to 10 days. Bigger ones maybe upwards to 10 to 14 days. In general, my patients show up around the 12-day. If they come in for a 12-day suture, they're usually about 85+% cleared up, sometimes even 100%. Usually it's about 2 weeks. And then they're done. And that's it.
Well,
2 weeks, you go back to your life. You go to the gym.
How long does it take the hair to actually grow out?
Well, it grows right away, right?
No, the hair falls out and goes dormant. It's a whole process. And then it doesn't start growing for up to 3 to 6 months. It's a slow, drawn-out process. So it goes dormant, starts growing 3 to 6 months, and then goes a half inch a month once it starts growing. So a lot of patients will see some patients grow early. So you'll see these crazy results on the internet where the guy's like, I'm at 4 months, I have plenty of these cases. But on average, that's not the case. Usually it takes 12 to 18 months before you get the final result.
Is it ever going to be as thick as it was originally on a person's head?
So that would vary based on if there's hair in the area we're putting it back into. So, for example, if we're putting hair into an area that has no hair, we can generally recreate 20 to 40% of someone's natural density from one procedure. So you're not going to get it up to speed if you have your normal hair behind it and we just do one case. We're going to need a second to balance it.
Now,
but the good news is most patients lose half their hair before they even recognize they have hair loss. So we're not trying to get you at 100. We're just trying to get you to the 50% point. So if I can give you 20, 30, let's say 30% each time of your natural density, I get you over the 60% point, you're happy. I mean, the majority of my patients only do a procedure, believe it or not. That's about 50%. And then I have about another 40% that do a second. And then we got that 10%. Those guys want more. So there's plenty of those guys. Like I just did a guy that came in for a fourth one. He already looks great, but he wanted more. Those guys exist.
Well, also there's a lot of different stages of hair loss. How far is too far where you can't do anything for the guy or gal?
Well, kind of what we were touched on a little earlier. If there's no hair, nothing. But usually if you have donor, I can do something for you. I mean, everything helps. I mean, you know, even if they got a little donor, we can put a little fuzz up there for you if you want. I mean, you know, people just, it's funny because the guys come in, they like have like 5 hairs on their head, right? And I don't mean to downplay this, and I know how serious it is. And they're like, please don't cut those. Please don't cut those. Please don't cut those.
That's
they're
pretty funny.
like, that's all they got. They're holding on for dear life.
And you know, so for most people that are getting a moderate hair recess thing, how about an approximate? Everybody's going to be different because it depends on how much hair has to be moved around. What's the cost of something like this to an average? And is it covered by insurance at all?
Okay, so it's an all-cash business for most doctors. However, if you do have a something that's medical necessity, you can submit it on your own to insurance. You know, I've had plenty of patients that submit to insurance for medical stuff and got paid out. But we don't do that. And prices range from $6,000 upwards to $28,000 for me. Yeah. Now you can go and find cheap hair transplants. I mean, that's what people are doing. They're going to Turkey and getting.
Yeah, I don't think that's nobody wants to cheap out on.
The only
medical.
turkey I want is during Thanksgiving.
Don't do that.
Surprise.
Yeah, well, those are the people that later on say I should have. You know.
Oh my God! Well, they come back and I fixed it. It cost them more in the long run.
Exactly.
You know,
pay me now or pay me later.
Yeah.
You get what you pay for.
100%. So if people want to reach out to you, how would they be able to reach you?
Thank you very much. So my name is Dr. Brett, B-R-E-T-T, Bolton, B-O-L-T-O-N. I'm located in Fort Lauderdale, Florida, doing a lot better weather-wise than you guys.
So wait, this is a twofer. The guy can go down there, have a vacation, and get his hair done.
That's right.
That's what people do. They bring their family. They stay on the beach and they stay in the hotel where their kids
I'm willing to do that. Do anybody out there want to do this? I'll just join you.
Thanks. And the website is greathairtransplants.com. Greathairtransplants.com.
Well, listen, you know, you have a lot of older folks down there in Florida, so I guess that could be a booming business, no doubt about
it's
that.
Not just older folks that lose their hair.
Well, no, everybody, yeah. And I guess the people that are younger that lose it, that want to do that. And what percentage of that hair that you transplant survives the transplant?
Oh, yeah, great question. And as far as all the studies show, we usually have with the when we open it up, the technique where we open it up, usually only about a 5% loss rate is what the numbers show through the studies.
That's pretty cool.
So when you do the follicular extraction, it's higher because they have a higher transection rate, meaning they're cutting more of the grass.
And once it all grows in and everything like that, you can comb it. Nobody would ever know.
Oh yeah, you know, my worst nightmare is someone says to me, "Hey doc, I saw your hair transplant." No, these should be undetectable. They should be completely undetectable. If they're detectable, I tell my patients, come back. I'll fix it for free. No one should know you had a hair transplant.
Now, how often people who've had hair transplants, how often do they have to go for haircuts?
Your regular schedule. So your hair grows a half inch a month, however often you go.
Wow.
Yeah.
Do women do this too, or no? Is that women only have alopecia?
So yes, they do, but it's not quite as common. And women have different reasons for their hair loss.
Menopause.
They may have that genetic male pattern hair loss as well, but they can also have some, hormonal stuff going through menopause. Right. Collagen vascular disorder.
By the way, anybody realize what that name is?
What?
Menopause.
Yeah, we get it. All right. That's where the guys want to run to at that point in time. So, we assume insurance does not cover any on this, right?
I mean, they can try to get it through their insurance if they want, but we don't take any insurance.
Yeah,
Listen, the amount of money that is spent on if you're getting real hair is going to be costly over the years. So get it done once and get it done right.
Right.
Yeah. Dr. Brett Bolton in Fort Lauderdale, Florida.
Hey, that's pretty cool stuff. Great information. I think we really learned a lot. There's so much stuff you hear out there.
You don't know what's real and what isn't.
One final question. All these creams that people say that helps you save your hair and stuff like that. And
make you look 20 years younger.
Do they work on some people or no?
So quick answer, no. But my answer to the patient is if you feel it's working, use it.
Right.
The only medications that I currently recommend are the FDA-approved treatments, and there's only 2 of them, and that's the finasteride, which is the brand name is Propecia, and the minoxidil brand name is Rogaine. And they've both been out 50 plus years, and they're FDA approved to help prevent future hair loss.
Yeah.
Nothing currently
It's
is
not going to help you
back.
grow your hair back.
You think it'll ever get to the
Yeah.
point where, I mean, the thing that scared me was when one of the Star Treks, the later ones, Picard was bald. So they hadn't solved it even by the year, whatever that was, 3827. I was just...
Frank, it was a TV show.
Oh, I'm sorry. But I was just wondering, if is there some work being done that down the road, maybe this may not be needed or what?
Oh, man. Another great question. I think it's going to be solved quicker. I think this AI is intense and it is moving so fast. I really think they're going to be able to reverse it.
Keep in mind, Dr. Bolton, AI is just people's information that it gathers.
Yeah, but it can do the type of
it just gets you the information
research
faster.
and create the right chemicals to make this work.
On AI. It is people's information that have put it out there that it gathers and puts together for you.
Yeah.
It just makes it faster to get the information. It's not a scientist. I hope people understand AI is not real.
Right, but it can actually solve a lot of the world's problems.
What's the first initial?
Medically.
Artificial.
Well, that's what you need, Taylor. Some really smart machines out there. All right. So, we were speaking with Dr. Brett Bolton. Make sure you, if you have any further information,
give them the website again, please.
Thank you. Great Hair Transplants.com. GreatHairTransplants.com, Dr. Brett Bolton.
All right, we're going to have you on
cool.
again because it's really interesting conversation.
I'd love to be back.
Okay, you got it. Stay warm down there. We can't.
Thank you.
All right.
Take care. Have a great weekend.
Thank you so much, guys.
Bye-bye.
Appreciate it. All right, bye-bye.
Bye-bye. Yeah, a lot of interesting conversation because you never think about
Well, these guys know their stuff. I mean, there's no doubt about it.
Well,
I would trust him.
This guy is like the top guy in the country. He does movie stars and, all the top people.
There you go.
He's a really smart guy. So
gotta just
look who's
bring your
Tom
pocketbook.
Andershak from Classic